Hello, I'm Lisa Carlson. I'm a past president of the American Public Health Association, and I was excited to join the Texas Children in Nature Network in December of 2021 to talk a little bit about social justice, which for me is at the intersection of COVID-19, mental health, and nature. It was good to be with you in Texas. My wife has family in Texas, and we vacationed in places like the Hill Country that you can see here. And it was good to be with you then. The recording didn't work out, so we're going to try it again today and talk a little bit about mental health, particularly about COVID, the impact of nature. And I want to finish up talking about crossing sectors. Now, I'm a public health person, and so I have spent my time as APHA president talking to public health people about the value of nature. And it was really fun when I was with you to talk about nature to nature people. And so I also want to talk to you a little bit about where I think public health and nature folks can work together to make a difference in these issues. So let's start by talking about the next pandemic wave, which is really a lot about COVID-19 grief and mental health. Now, I want to set the stage for you, which is that we were not naive before COVID. We knew that we had deeply embedded social and racial inequities. Americans with pre-existing conditions, no national paid sick leave, little to no savings. We knew we were at risk. And people like public health people and other people have been sounding the alarm that the social determinants of health really impact health and were at issue even before COVID. But the realities laid bare by COVID are even harder to ignore. We know that things like poverty and racism and housing aren't just correlated with poor outcomes, but can cause them. The simple fact is inequity kills, and that has been magnified by the pandemic. We have been living through a collective recurring trauma. And we're up to what now, 23 months now in February of 2022? 23 months of grief, anxiety, isolation, and rolling trauma compounded by a number of stressors that you see here. I mean, talk about supply shortages and scarce resources. You know, what's the thing of the week that is in scarce supply? It's been kind of a nonstop, a litany of things that are hard to get. These are magnified by the other large-scale things like police killings of Black people, mass shootings, record wildfire seasons, the Texas power crisis, unemployment. And then there are things that are very personal to us, like disrupted routines, the incredible sense of unknown, and the absolute persistence of this pandemic. And all of this has a real grief to it for all of us. And then there's the people who are actively grieving the loss of people to COVID-19. As of right now, in early February 2022, more than 900,000 Americans have died of COVID-19. Each of those deaths leaves an average of 9 close relatives behind. That's more than 8 million Americans in the active process of grief. When I was with you in early December, it was 775,000 deaths and about 7 million Americans in grief. So this number is going up quickly. And it's at a time when our rituals of mourning and loss have been really disrupted. I mean, I think many people now know people who've been to Zoom funerals. And this has been disproportionately felt by people of color whose relatives were more than 2 times as likely to die of COVID-19. There are a number of people asking the question too, whether COVID-19 is an adverse childhood experience. And there are reasons to think why that might be true. Exposure to increased parental anxieties, things like job loss, food insecurity, housing insecurity, toxic stress levels around kids. I also want to point out though, that 1 US child loses a parent or caregiver for every 4 COVID-19 associated deaths. If we're at 900,000 deaths in America to COVID, that means we're talking about more than 225,000 kids and counting who have lost a parent or caregiver to COVID. And again, a disproportionate effect on low-income and ethnic minority populations who are already at increased risk for ACE-impacted chronic conditions like the ones that you see here. There are manifestations of unaddressed grief. So many of us in public health are talking about the grief that's coming with COVID-19 and that we aren't really as a society dealing with this massive amount of grief. And there are impacts for children and teens and impacts for adults. You can see they overlap: anxiety and depression, behavior issues, increased stress, sleep disturbance, substance use. The power of grief to derange the mind has been exhaustively noted. I'm here to tell you that grief is a mental health crisis, and it's the next public health crisis The next pandemic wave is grief, and we are in it now. And it requires a public health response for the collective good, because what is public health if not in support of the collective good? The simple fact is we do not have a vaccine for our mental health like we do for our physical health. And I have been arguing that this is the moment, if there ever were a moment, this is the time to break down the barriers to talking about mental health. We have got to talk about mental health. In an average year, 1 in 5 US adults struggles with poor mental health. And if that number weren't high enough, in the COVID-19 pandemic, I think everybody knows somebody who's struggling with their mental health if they aren't struggling themselves. So I think this is something public health needs to be passionate about, because these hard things are connected, and mental health is at the center of so many of them. Poverty, the global pandemic, unhealthy environments, violence and suicide, substance use and abuse. These all have a mental health component to them. And so we must acknowledge the impact of mental health broadly when talking about COVID-19. Every time we talk about COVID-19, we should talk about mental health. Every time we talk about public health, we should talk about mental health, and not just in a global pandemic, because mental and physical health are impacted positively and negatively by the same factors. These things that you see here, the environment, employment, access to healthy food, safe and affordable housing, access to nature, transportation, healthcare, education. This is public health. And these are the very factors that impact both our physical health and our mental health. Mental health is public health, and it's a social justice issue. And I want to talk a little bit about how we deal with that from a public health perspective. One of the things that I have been known for talking about in my APHA presidency is the value of nature in thinking about mental health. I've been talking a lot about how I love trees. I am, in fact, a tree tourist. My wife and I have gone on a number of trips expressly for the purposes of seeing the trees in those places. And I think there's a lot here that we can learn, especially from groups like yours, as we can partner to address these kinds of issues going forward together. Because I don't have to tell you, nature improves mental, physical, and environmental health. But we have work to do here too, because inequitable access to nature is also a social justice issue. So let's talk a little bit about nature as public health. The environmental value of trees, well documented, reduces air pollution, lowers air temperatures, filters water, reduces stormwater runoff, provides natural habitats, reduces noise pollution. I also would argue trees are part of the public health team. There's research that shows that good health and well-being, you have the highest scores in those if you spend 120 minutes a week in nature, 2 hours. And it doesn't sound like a lot, except that people spend more than 90% of their time indoors. And that was before the widespread isolation caused by COVID-19. We've got to be able to get people outside. And I want to think with you for a second just about the difference in this particular crisis and pandemic from many other crises that we deal with. The Sierra Club pointed this out. In the midst of natural disasters like floods, storms, and wildfires, we are called on to come together. But in this particular crisis, we are called on to stay apart. And so nature, even from the very beginning, nature has been a place where we said to people, you can find respite, you can safely be together in the outdoors, and it's a place of reconnection and rest. And so equal access to those things is critical. At the start of the pandemic, the very start, March 2020, when we went into lockdown, we told people, go outside, make sure you go outside. But we weren't recognizing that many people don't have access to safe green spaces outside their homes. So just as this pandemic has shown a light on so many inequities, yet another pandemic inequity is this idea of access to nature. There is, fortunately, a growing appreciation of nature among urban dwellers during the pandemic. 70% of urban dwellers said they increased visits to local nature during the pandemic, and more than 80% reported increased importance of access to that green space. Many said it gave them safe places to socialize, gave them peace and quiet for contemplation, to reduce stress. Again, the effects of the pandemic have been most heavily felt by populations which were already vulnerable when COVID struck. and most lightly felt by those who were not. And so we see people say things like access to safe nearby nature must be prioritized as a critical public health infrastructure and not just an amenity for the few. And think about that word for a second. An amenity. Is nature an amenity? I don't think so. I don't think you think so. It's critical public health infrastructure. And the fortunate thing is demand for urban green space is increasing. But it's happening at the same time of growing losses of urban green space, decreasing priority for those spaces, and unequal access as a function of income and race. Now, you know, nature's benefits are relatively greater for those who are negatively impacted by economic disadvantage, systemic racism, trauma, opportunity gaps, and other challenges. We know nature's benefits are relatively greater for these populations of people. But there are racial and economic disparities. 74% of US communities of color live in nature-deprived areas, compared to only 23% of white communities. 70% of US low-income communities are in nature-deprived areas. That's 20% higher than communities with moderate or higher incomes. If you take those together, 76% of low-income communities of color live in nature-deprived places. Why? Nature deprivation is a consequence of a long history of systemic racism, redlining, forced migration, economic segregation, violent dispossession of land, violence and intimidation and threats to people of color when they're in nature. Let me say clearly that we believe in public health, that racism is a public health crisis. I am proud to live in DeKalb County, Georgia, which is one of thousands of communities across the country that have declared racism a public health crisis. The Sierra Club takes it one step further. They say racism is killing the planet because you can't have climate change without sacrifice zones, and you can't have sacrifice zones without disposable people, and you can't have disposable people without racism. And this is what it looks like. These are two communities in LA. The community on the left is a higher income community where people can afford to plant and care for trees. And the community on the right is a low income, largely minority community where a lack of public investment has meant fewer trees. And there is a direct health impact of this difference because communities with lower tree canopy, these poorer communities, can be as much as 10 degrees hotter than the wealthier treed communities on the same day. 10 degrees of increase in heat has a direct impact on health. So there's a public health impact to having inequitable access to nature. Less air and water purification, climate mitigation, disease control, fewer opportunities for recreation, more susceptibility to asthma, which is also a risk for COVID-19. These urban heat islands, as I mentioned, which exacerbate diabetes and heart disease conditions, heat waves that lead to heat exhaustion and heat stroke, and the deprivation of the mental health benefits that I've been talking about us needing so much. I think lack of access to nature is particularly unacceptable because nature is the original public good. And I think this is a problem we can't ignore anymore and that we can do better. The Center for American Progress, they use this same word. Nature is not an amenity, but a necessity for everyone's health and well-being. And their goal is to protect 30% of lands and oceans by the year 2030, and to do so in a way that ensures that nature's benefits are more evenly and fairly distributed among all of the nation's communities. Let me give you an example where I live in Atlanta. The city of Atlanta and the Trust for Public Land worked together in one of our West Side neighborhoods that had long suffered from flooding and crime and poverty and lead contaminated soil. And they built this park here that you see on the left. It's a 16-acre park. And they built it with an integrated stormwater management system to stop the flooding. And they also created it as a safe space. If you notice, almost any place that you would be in that park, you can see most of the rest of the park. And so this is a green space with a public-private partnership that was put into an area that needed help and then provides safe green space access for people in that neighborhood. So these are the kinds of things that we can do. We can also do things like supporting nature-based learning and play and recreation in neighborhoods and schools and libraries, and creating more green spaces in safe and culturally appropriate outdoor programming for those spaces. We can invest in environmental protections in diverse and marginalized communities, and supporting green spaces where underrepresented groups can access them, like cities. And we can invest in organizations that increase equitable access to nature, like our hosts. The Texas Children in Nature Network had a strategic plan which calls on the very things I'm talking about: to advocate, to raise awareness, to inspire nature-based learning, to use nature as a health strategy, encouraging nature-based experiences, leveraging a diverse network to amplify our impact, and increasing welcoming natural spaces accessible for all children. So what can we do? Well, one of the things we can do is plant trees equitably. So the tree equity score says, if we planted 522 million trees in every urban area in America with a population of 50,000 people or more, we would achieve tree equity. We'd also create 3.8 million jobs, clean the air, and save $5 billion in the process. Now, I was giving a similar talk last fall in a state out west, when somebody came up to me and said afterwards, you know, we are planting trees. We have an initiative to plant trees in our city, but we weren't thinking about where we were planting those trees. And we're going to go back and think about it a little bit harder. This is the kind of thing we need to do to achieve tree equity, which will improve health. So we have work to do, but I think that we are the people to do it. We in public health, you in nature. I think that this is work that we can do together. Well, why should we do this work? I know I'm speaking to the choir here, but again, back to our hosts, because they put these values out there that are the very things that we're talking about. Connection to nature is a human right, and we protect what we love. Nature heals the body, the mind, and the spirit, and in our diversity, we are stronger together. Ultimately, we are working on a solvable problem. And if the pandemic has taught us anything, it's taught us that we have great capacity for change. And we can change with great speed. Think about your life in March 2020, what it looked like in the beginning of March and what it looked like in the end of March. Our ability to change our daily lives with such a tremendous amount of change in such a fast amount of time. I think we can put these kinds of lessons to work at making changes that impact things even more broadly, like climate change. If we've learned anything in this pandemic, we've learned that we are all interconnected, and that what hurts the vulnerable first will hurt everyone next. I think that we can change the narrative of nature in the United States, but we can't, any of us, do it alone. And so I want to talk about crossing sectors. And normally, as I said, I'm talking to public health people about this, but I'm encouraging them to talk to you. And so I want to encourage you to talk to them. There are a lot of people who talk about public health 3.0, which is really the idea of crossing sectors, saying that local public health is a great group to convene all the players at the table who impact the various parts of social determinants of health: environmental folks, employment folks, housing folks, education folks, transportation, and healthcare. We in public health are the kinds of folks who can convene those groups. Let me give you an example when we work together of what it looks like. This is Air Louisville, and this was a government, nonprofit, and tech partnership. And they were having problems in Louisville with asthma attacks and ER visits. So they put little electronic inhalers, put little sensors in the inhalers, and they crowdsourced real-world data about where people were using their inhalers and having to seek medical care. So they created a heat map of places that had concentrated pollution. Now, they've changed care plans, don't get me wrong, they did do that, but they also changed policy, they planted trees, they changed zoning, and they rerouted trucks. I mean, they planted trees. This is the kind of partnership where we want to think about holistically, what are the ways that we can change our air quality, which will change health. And again, this was a government, nonprofit, and tech partnership. So I think the future of public health is people working outside of traditional public health with groups like you to frame and address what's the concern of your community and work on those shared community concerns with everybody doing the part they do best to bring together all the different aspects of the social determinants of health, because they are all linked. So I challenge you to think about what are the connections in your community and to be the organization that connects all kinds of people to nature and to public health. I'll leave you with these final thoughts. My message is to you. Mental health is public health. Inequitable access to nature is unacceptable. This is social justice. This is public health. And I submit to you, Texas, this is our lane, yours and mine both. The final thing I want to say to you is I have been traveling the country and talking by Zoom both for the last few years as people have been trying to work through this pandemic and still make change in the world. One of the things that I like to say is that we in public health are not individual trees out there alone, but we are a healthy forest of public health with our partners like you. And so I want to call on you to make sure that you are going out into the trees to get respite of your own during this work, but also the healthy forest of nature folks, public health folks, all of these partnerships that together we can be, to join forces in those places to restore your nature spirit, your public health spirit, to light the public health spirit anew. And so I hope that you will take time to spend time in the trees, both literally and figuratively. If these are the kinds of things that you enjoy talking about, then I would welcome you to engage with me on Twitter. I thank you very much for the invitation to have been with you in December. I thank you very much for your time in watching this talk today, and hope to see you soon among the trees.